Hello everyone. I am Dr. SONAL JAIN, Consultant Physician, Kamineni Hospitals, Hyderabad. November is considered as the Lung Cancer Awareness Month because of the increasing number of lung cancers and the associated deaths. So it is important to know few important aspects related to lung cancer. Today I shall be discussing regarding the causes of lung cancer, symptoms of lung cancer, how do we diagnose, what is the treatment, and what is the prognosis or what is life after lung cancer. What are the causes of lung cancer? The number one cause is cigarette smoking or tobacco consumption in any form. In few patients, we have found that they have never smoked cigarettes or tobacco, still they have got lung cancers. So the other causes of lung cancer could be air pollution, exposure to asbestos, exposure to radon, second-hand smoke, then HIV cases, or if there is family history of lung cancer. These are the important causes, but the predominant cause is cigarette smoking. When we come to symptoms of lung cancer, the most common symptom is persistent cough that does not go away. It retains for 3 to 4 weeks even after taking antibiotics or medical treatment. The other symptom is blood in sputum, shortness of breath, chest pain, weight loss, loss of appetite. When there is spread to other organs, there could be neurological symptoms like headache, vomiting, seizures. When there is spread to bone, there could be back pain or bone pains. So these are the common symptoms, but the most common symptom is persistent cough, which might we get confused to tuberculosis where there is persistent cough. So how do we diagnose lung cancer? So if there is initial suspicion, when suspicion of lung cancer, we do chest X-ray, wherein we might see a spot or a lung lesion on the X-ray, which like I said, it could be similar to the ones in tuberculosis, which is very common in India. So for the same, to differentiate, we do sputum examination and HRCT chest. Thereafter, to confirm the diagnosis of lung cancer, we do lung biopsy. Lung biopsy can be done via passing a tube via bronchoscope or windpipe, that is called transbronchoscopic examination or biopsy, or directly via the chest wall, that's called CT guided needle biopsy. So the confirmatory diagnosis of lung cancer is via lung biopsy. Now once the lung cancer is diagnosed, we must stage the lung cancer. There are 4 stages which we do based upon the PET CT scan. So for staging, we do PET CT scan of the whole body, and thereafter we see whether it is stage 1, stage 2, stage 3 or stage 4. Stage 1 is a very small tumor limited to one lobe of the lung, and if it is stage 2, it's a bigger tumor, but only the local lymph glands or lymph nodes are involved. And if it is stage 3, then the glands in the middle of the chest, that's called mediastinal lymph nodes, they are also involved. Once it starts spreading to the chest wall, chest space, that's pleural cavity leading to pleural effusion, or the wall of the heart or the space of the heart, thereafter it causes pericardial effusion. When it spreads to the brain, or it can spread to the liver or to the bones or kidneys, adrenals. So there it's called stage 4, that's a distant metastasis. Staging is important because the treatment is based upon the stage of the lung cancer. So what are the treatment options available? We have mainly 3 treatment options. One is surgery, second is systemic therapy, and third is radiotherapy. So if the tumor is limited only to the lung, then surgery is the best option available. If the tumor spreads to other areas, then it's called advanced cancer, and we have other treatment options like systemic therapy and radiotherapy. Systemic therapy we give via oral tablets or intravenously via injectables, which could be in the form of chemotherapy or targeted therapy. Chemotherapy also destroys a few normal cells of the body, but targeted therapy is mainly focused or directed towards the cancerous cells, and it has minimal side effects. In few patients, we also give radiotherapy. So the main treatment options are surgery, systemic therapy, and radiotherapy, which are used singly or in combination lung cancer. Now we talk about the most important question: is there any life after lung cancer? What is the prognosis of lung cancer? So if we are able to screen patients, that is high risk patients, with 20 pack years of smoking. 20 pack years means smoking 1 pack of cigarette per day for 20 years or smoking 2 cigarette packs per day for 10 years. Those people are at very high risk, and those people who are aged more than 65 years. These two categories we can screen via a low density CT scan on a regular basis, and if there is suspicion because of the symptoms, early diagnosis and aggressive treatment can help in treatment or cure. So yes, there is a cure possible provided there is early diagnosis and aggressive treatment done.